Hello and thanks for watching. This is Dr. Phil Harrington with Laser Lessons from Dr. Phil. My topic today, can I laser a patient with cancer? As always, feel free to contact me if you have my other modes of contact information. You're certainly welcome to reach me that way or through my laser lessons from Dr. Phil at gmail.com email address. So for the past 15 years of being the medical director for a Class 4 therapeutic laser company, one of the most difficult yet most frequent questions that I have to answer is, I've got a patient with cancer, can I use the laser on them? And you see a few examples here of questions that come in. These were emailed to me just in the last month. And some of these questions can be very difficult and complicated. And this presentation, it's not a very long presentation, but I will try to answer that question. Can you laser a patient that either has a history of cancer or has active cancer? And then also, where would you use the laser on them? Could you use it potentially over the cancerous site itself? So let's dive into this, and here we go. Now, when I teach my CE classes on risk management, and when I talk about this topic of using a laser on a patient with a history of cancer, and the same logic applies to using the laser on a pregnant patient or other risk management topics, there are many reasons why we do or do not do things. Now let's just imagine that you and I are in person speaking face to face, and when I'm teaching a CE lecture, I will pick someone out in the classroom and I will just walk up to them and ask them, why don't I punch you in the face right now? Now there's many answers for that question. You could hit me back. The other people in the room would certainly come to your defense. Doing this is assault and I would be charged and arrested. It's simply not nice, and I'm a nice person. It would hurt my hand. I like you, you're my friend. And there could be other reasons. So I've just listed 6 reasons there, and that's the kind of logic that I'm wanting us to think about when it comes to using the laser on a patient with a history of cancer. And so I divide this into 2 categories. On the left side, it's going to be the scientific, physiological. Maybe you could even call that real world. It's what I would do for my family and for myself. And there you see me pictured with my 2 daughters. So when I answer in that fashion, when I answer over here, that's what I would do for myself and for my family. And then on the right-hand side is the medical legal and the liability reasons. And on that side, on the right-hand side, it's what I would do to protect my liability and my license to practice. So realize that when we answer the question, can you treat a patient with cancer, there are 2 ways to answer that, and there are reasons why we do it that way. So first, let's take a look at photobiomodulation, laser therapy, photobiomodulation, and cancer. What do the studies show? So I will go through a fairly quick summary of what the current published research says. Now, of course, you can pause the video and get the name of the article, and if you can look it up, by yourself, or if you want to ask me for it, I'll be happy to share with you. So let's take a look at these studies. This first one is from one of the top laser journal, Lasers in Surgery and Medicine, from 2015. Selective cytotoxic effects of laser on human oral cancer cells. And going straight to the conclusion, our findings imply that low power laser irradiation might be a potential therapy for oral cancers. Now, just a side note here, they are using the term low power laser irradiation. I have other videos on my laser lessons from Dr. Phil's site where I talk about, why is it called cold laser and the whole history of terminology used for laser therapy or photobiomodulation. I guess just understand that we're talking about essentially the same thing here. You can, if you look in the materials and methods, you see they're using a wavelength of 810 nanometers and a energy density or dosage of 10 to 60 joules per square centimeter. So once again, their findings indicate that photobiomodulation could be a potential therapy for oral cancers. In other words, use laser therapy to actively treat cancer. This paper was a small animal study done with mice titled Laser Therapy Inhibits Tumor Growth in Mice by Promoting Immune Surveillance and Vessel Normalization. And so that's something that we've known from the tissue biological effects of laser therapy, is that treatment with the laser stimulates a local immune response. So let's look at what this paper says. While laser light increased cell metabolism in cultured cells, the in vivo outcome was reduced tumor progression. This striking, unexpected result was paralleled by the recruitment of immune cells, in particular T lymphocytes and dendritic cells, which secreted type 1 interferons. So they are saying that they took these tumor cells and put them in a petri dish, and yes, exposure to the laser did increase the cell metabolism of the cancer cells in vitro. However, the outcome in vivo was reduced tumor progression. And they go on to say, collectively, our results clearly indicate that any experiment assessing the effect of laser light on culture cells is not representative of the in vivo condition. Because they got, as I just said, with the in vitro results, increased tumor cell growth, in vivo results, decreased tumor cell growth. Very interesting. Another study on the cost effectiveness of laser therapy in head and neck cancer patients receiving concurrent chemoradiation. The conclusions, our results indicate that morbidity was lower in the laser group and that laser therapy was more cost effective than placebo up to a threshold of at least $5,000 per mucositis case prevented. So in other words, these cancer patients undergoing chemotherapy, it's about 50%. When you have someone who is undergoing chemotherapy, about half of them will develop oral mucositis. And so here they are showing that yes, when this patient has active oral head and neck cancer, they are using laser therapy as an active treatment for the oral mucositis, and the morbidity was lower in the laser group. In the systematic review of photobiomodulation for the management of oral mucositis in cancer patients and clinical practice guidelines, the conclusion: the evidence supports the use of specific settings of photobiomodulation for the prevention of oral mucositis in specific patient populations. So once again, similar topic here, patient has cancer, they are undergoing chemotherapy, and they are recommending that photobiomodulation is used on those patients with active cancer. This paper is entitled Photobiomodulation in Cancer, What is the Truth? And the primary author is Dr. Michael Hamblin, who had been the fellow at the Wellman Center for Photomedicine associated with Harvard Medical School. And he concludes, photobiomodulation therapy may have benefits in cancer patients and should be further investigated. And in the paper, they talk about different effects where in this figure as they show cancer therapy side effects that could possibly be treated with photobiomodulation. So in other words, this patient has cancer. They are undergoing a cancer treatment, and Dr. Hamblin is suggesting that while they are undergoing the cancer therapy, that they receive photobiomodulation treatments as a treatment for these side effects. Now we see this quite a bit. He's got peripheral neuropathy listed there. We have studies that show that class 4 laser therapy is greater than 90% effective at resolution of symptoms, at least helping the reduce the modified total neuropathy scores of patients with chemotherapy-induced peripheral neuropathy. And so again, here in this paper, Dr. Hamblin is arguing that laser therapy should be possibly used as a treatment for these cancer side effects. Another paper, the role of photobiomodulation in the care of cancer patients. The findings suggest that photobiomodulation therapy is a promising option for the management of these cancer therapy-related side effects. Impact of photobiomodulation in a patient-derived xenograft model of oral squamous cell carcinoma. The conclusion: in this study, photobiomodulation did not impact the behavior of the models. This is an important preclinical outcome regarding safety concerns of the use of photobiomodulation in cancer patients. So once again, if you want to look up this article or contact me, I'd be happy to share a full copy of it with you. But this study and essentially all of them that I just went through indicate that photobiomodulation is safe to use for these cancer patients. And some of them are arguing that it should be used as an active treatment. So going back to this slide that I started out with, I would say this. From the scientific, physiological, real-world experience, if any member of my family had cancer of any type, I would not hesitate to laser them. If I was diagnosed with any type of cancer, regardless, I would laser myself, and yes, I would laser directly over the tumor site. And that goes for any member of my family. That's my advice. However, medical legal, liability, protect your license. You have to think about worst case scenario. If you do use the laser on this patient, and worst case scenario, their cancer worsens, or worse yet, they die down the road, will you get blamed? So in answering from that standpoint of protecting your liability and your license, I would say that if a standard patient has or has had cancer, I would not laser them. So you've seen the evidence. In the end, you will have to decide. I'm not going to tell you what to do in this case. I've shared the evidence with you. I've told you what I would do with myself and my family, and I've told you what I would do with patients. This is Dr. Phil Harrington with Laser Lessons from Dr. Phil. Thank you for watching, and have a good day.